Welcome to the Explainer. All right, for all you nursing students out there, this one's for you. We're doing a clinical deep dive that goes way beyond the textbook to get you ready for your burn unit rotation. We're going to cover everything from telling the difference between a scald and an immersion burn, all the way to understanding the crazy hidden dangers of electrical injuries. So, let's just jump right in. Okay, picture this. A burn patient comes rolling through those ER doors. Right away, the clock starts ticking. Your first assessment is, without a doubt, the most critical step, and it all boils down to one simple question. What kind of burn are we actually dealing with?
I know, we're starting with a heavy one, but I promise you it is so worth it. Nailing the difference between coagulation and liquefaction necrosis is the absolute key to understanding why some chemical burns are just so much more destructive than others. You get this concept down, and you are going to be way ahead of the curve.
All right, now that we've got our brains warmed up, let's dive into the most common type of burn you are going to see in your clinical practice: thermal burns. But don't let that simple name fool you. There's actually a little more to it than just heat.
This right here is the bread and butter of burn care. Seriously, think about it. From a toddler pulling a pot of boiling water off a stove to a firefighter caught in a blaze, over 90% of the burns you will ever treat fall into this category. That's why mastering the different types of thermal burns, totally non-negotiable.
Okay, so take a look at this image. This is a classic scald burn. You can see the blistering, the redness, but here's the clinical pearl, the thing you have to remember. With scalds, what you see is often not what you get. The injury can look deceptively shallow on the surface, but that damage can go so much deeper into the tissue.
All right, time for a quick clinical pop quiz. Just think about the patients you've seen, the case studies you've read. Who do you think is most at risk for this specific type of burn?
And yep, the answer is young children and the elderly. It makes sense when you think about it, right? Little kids are so curious, and they just don't understand the danger of a hot stove or a bathtub full of scalding water. And for our older patients, things like decreased mobility and sensation can make them much more vulnerable to these kinds of accidental burns.
Okay, this is one of the hardest but most important parts of our job. As nurses, we're not just caregivers. We're advocates for our patients, especially the most vulnerable ones. So when a child comes in with a burn, you have to be their voice. You have to be their protector. And that means always considering the possibility that it wasn't an accident.
So, how can you tell the difference between an accident and abuse? You have to look for the story that the burn tells. An accidental splash, it's going to be irregular, with little droplets scattered around. But an intentional immersion burn, it'll have a clear tide line, a really uniform depth, and that classic sock or glove pattern that shows the child was actually held in the hot water. These aren't just signs, they are evidence.
All right, let's throw you a little curveball here. We've been talking a lot about heat, but is it the only thing that causes thermal burns? What do you think?
The answer is false, and here's why. Frostbite is technically a cold thermal burn. The damage isn't from heat at all. It's from the opposite extreme, ice crystals literally forming in the tissue and destroying the cells. It's a great little reminder that thermal injury is all about temperature extremes.
Okay, so we've got a pretty good handle on thermal burns now. Let's move on to the ones that are less frequent, but, you guessed it, often way more dangerous: chemical and electrical burns. With these injuries, the real danger is what you can't see.
Electrical burns are pretty rare, making up less than 5% of all burn unit admissions. But please, do not let that number fool you. These are some of the most devastating injuries we ever see.
Seriously, think of an electrical burn like an iceberg or a lightning strike. The entry and exit wounds might look really small, almost insignificant, but that current tears through the body like a bullet, causing just massive damage to muscles, nerves, and organs all along its path. It is a true medical emergency.
Now let's talk chemical burns. We all know that acids and alkalis are both incredibly dangerous, but which one actually causes more damage to human tissue? The answer might surprise you.
And here it is. This is where that whole necrosis concept we talked about at the beginning comes back into play. Acids cause coagulation necrosis, which creates a hard, leathery scab that actually limits how deep the burn can go. But alkalis, they cause liquefaction necrosis. It's like pouring drain cleaner on the skin. It literally dissolves or liquefies the tissue, allowing the chemical to just keep eating its way deeper and deeper. And that's why alkali burns are so much more severe.
So what does this mean for you as a future nurse? Well, it means when you get a patient with one of these burns, you have to be prepared for a long, tough road to recovery. They might have survived the initial injury, sure, but their battle is often far from over.
We've spent a lot of time talking about the different ways a person can get burned, but now it's time to zoom out and look at the bigger picture. Because no matter what the cause, a major burn isn't just a skin injury, it's a full-body crisis.
Now, before we get into the systemic effects, let's just quickly touch on a couple of other burn types you might see. You've got friction burns, think road rash, which are a mix of an abrasion and a heat burn. And then you have radiation burns. They're pretty rare, but they can be caused by anything from a really severe sunburn to radiation therapy for cancer.
But here's the thing. Whether it's from fire, a chemical spill, or a jolt of electricity, all major burns share one fundamental massive problem: the destruction of the skin, our body's largest and most important protective organ.
And when that barrier is gone, all hell breaks loose systemically. First, you lose your shield against the outside world, so the risk of infection just skyrockets. Second, you can't hold in your body fluids anymore, leading to massive dehydration and the risk of hypovolemic shock. And third, you lose your ability to regulate your own body temperature, putting you at risk for life-threatening hypothermia. As a burn nurse, you're fighting all of these battles at the same time.
We have covered some incredibly complex pathophysiology in this explainer, but I want to end with a question that really brings us back to the basics of nursing care. What is the single most important thing we can do to prevent the most common type of burn in children?
And the answer is as simple as it is profound: continuous supervision. Because at the end of the day, all the advanced medical knowledge in the world can't replace the power of prevention. As nurses, our job isn't just to treat illness and injury, it's to promote health and safety. And that's a responsibility we should all be really proud of.